Good day. My name is Mae Esther in Doinog and I'm from Group 7. Our topic is about Barbara Dossey, Theory of Integral Nursing. But before we move forward, I would like to start with an outline. Outline. Name of the theories and theory, major concept of the theory, fundamentals idea about the theory, how does this theory or philosophy relate to 21st century nursing practice, case, and under the case we have client assessment, client goals, nursing interventions, and rationale using Dossey's theory, and last but not the least is the client evaluation. First of all, who is Barbara Dossey? Barbara Dossey finished her Bachelor of Science of Nursing and Master's in Texas. And Barbara Dossey is the director of Nightingale Initiative for Global Health in Washington, D.C., Ottawa, Ontario, Canada, and the co-director at the International Nurse Coach Association and the director of Holistic Nursing Consultant at Santa Fe, New Mexico. Barbara Dossey is the pioneer of theory of integral nursing and nurse coach movements. That will be further discussed by myself and my group mates, and we will discuss a case scenario that is related to Barbara Dossey integral nursing. Thank you.
Thank you, May. Hi, my name is Dawa, and I'm going to talk about major concept of theory. There are four major concepts of theory. The first concept is healing, and the second concept is the meta paradigm of nursing theory. Third concept is pattern of knowing. And the last one is the four quadrants that are adapted from Wilber's integral theory: individual interior, individual exterior, collective interior, and collective exterior.
Thank you, Dolma. Hi, my name is Manpreet Mahal, and I'll be talking about fundamental ideas about the theory. So, the first is an integral understanding recognizes the individual as an energy field connected to an energy field of others and the wholeness of humanity. The world is dynamic, open, interdependent, fluid, and continuously interacting with changing variables that can lead to greater complexity and order. Next is an integral worldview is comprehensive ways of organize multiple phenomena of human experience from four perspectives of reality. So the first is individual interior, that is subjective and personal. And the second is individual exterior, that is objective and behavioral. And the third is collective interior, that is the intersubjective and cultural. And the fourth is a collective exterior, that is interjective system or structure. And the next is healing is a process inherent in all living things. It may occur with curing of symptoms, but it's not synonymous with curing. Next is integral health is the experience by a person as wholeness with development towards personal growth and expanding states of consciousness to deeper level of personal and collective understanding of one's physical, mental, emotional, social, and spiritual dimensions. And the next is integral nursing is founded on an integral worldview using integral language and knowledge that integrates integral life practices and skills each day. And the next is integral nursing is broadly defined to include knowledge development and all ways of knowing. And next is integral nurse is an instrument in the healing process and facilitate healing through his or her knowing, doing, and being. And the next is integral nursing is applicable in practice, education, research, and healthcare policy. Thank you very much.
Hi, my name is Abegail Picardo, and we'll discuss to you how theory of integral nursing relate to 21st century nursing practice. So the theory guides the nurses on how to improve themselves, patients, and their nursing practice. As nurses utilize integral nursing, they can be healthy, model health, and understand healing. This will improve nurses' abilities for empowerment, leadership, and being change agents, as well as sharing with others the depth of nurses' knowledge, expertise, and critical thinking capacities and skills for assisting others in creating health and healing.
So in our case scenario, we have patient Mr. Helmet Aniston, age is 55-year-old, male, marital status is married, occupation is construction worker, and the diagnosis is lung cancer. So client assessment is he has a history of smoking, he's feeling tired, blood pressure is 150/86, pulse is 80 per minute, respiration is 20 per minute, and temperature is 98.5 Fahrenheit. Skin is warm and normal in color. He has a wheezing in right chest, intermittent coughing, slight chest pain during deep breathing. CBC revealed mild anemia. Sputum cytology is plus small bronchogenic cancer. Chest X-ray is showing slight white grayish mass appearance. CT scan reveals a central mass approximately 4 centimeter in diameter with involved mediastinal and supraclavicular lymph nodes. Nursing diagnoses are impaired gas exchange related to decreased oxygen carrying capacity of blood, ineffective airway clearance due to increased amount of secretions and thick secretions, acute pain related to cancer invasion in the chest wall, and fear and anxiety related to threat or change in condition, and the knowledge deficit related to lack of information about the disease and resources. Thank you very much.
Hello everyone. Now I will deal with the client goals. Demonstrate improved ventilation and adequate oxygenation of tissue by ABGs within patient's normal range. Demonstrate patient's airway with fluid secretion easily expectorated, clear breath sound, and noiseless respirations. Report pain relieved or controlled. Demonstrate appropriate range of feelings and appear relaxed or resting appropriately. Verbalize understanding or ramification of diagnosis, prognosis, possible complication. Thank you, Tenzin. I'm going to talk about nursing intervention and the rationale using the theory of integral nursing. The first perspective is healing. Healing includes knowing, doing, and being, and it is a life journey. It is a process of bringing ourselves together in deeper level of harmony and inner knowing leading towards integration. The first component is the individual interior. Nurses will try to understand the patient point of view. Individual exterior. In that, nurses will try to explain more about the treatment plan and apply different techniques. Collective interior. Mr. Aniston needs to understand the effects of smoking. The nurse will assess and explore Mr. Aniston's concern, cultural values, and belief. Collective exterior. As a nurse, they will assess how the patient health influences his family and the environment. And Mae will take over from here. Thank you.
Hi, I will discuss metaparadigm as the second concept of theory of integral nursing, and Barbara Dossey made the Venn diagram, and the center is healing that surrounds nurse, health, persons, and environment. Barbara Dossey said that the nurse should know self-care principle. It means that us nurses should know how to take care of ourselves in order to take care of our patient. The second is health. Barbara Dossey defined integral health as evolving one state of consciousness to a higher level of personal and collective understanding. With this one, we should explain to our client, Mr. Aniston, how important is his health and what are the factors that cause his lung cancer. And as we all know, Mr. Aniston has a history of smoking. We should explain to him that one of the risk factors is smoking. And the second one is persons. Barbara Dossey said that persons are the individual, group, or community that comes to the hospital that needs the help or services from the nurses or healthcare provider. And she said that nurse is the health coach or the health diplomat for the patient. And the next is the environment. Environment, Barbara Dossey said that environment is divided into two. First is the interior, which is defined as the individual feeling of mental and emotional state. And the second is the exterior, which she defined as object that can be seen or measured, and that is related to the patient social status or social health. And Barbara Dossey always asks her client or patient, tell me one thing that you want me to know about you. And that question made the patient feels that the nurse is actually listening to her. And for the next concept, my groupmate will discuss. Thank you so much.
Now I will deal with the patterns of knowing intervention. First, personal knowing. Keep positive, good, strong, and caring relationship with the client. Second, empirical knowing. Educate client regarding the care of dressing at home, like cleaning the incision with lukewarm water, keep it dry and free from the dust and pollution. Advise to wear loose cotton clothes so that the incision will dry and heal faster. Advise discuss diagnosis, current and planned treatment, and expected outcome. Encourage to do relaxation with deep awareness practice and do it frequently. You breathe in and out, you go to the deeper space and you will create a healing. Third, ethical knowing. Respect the choices of treatment. Keep the conversation about health, client privacy, and confidentiality. Identifying needed resources and support to enable client to follow their wishes. 4. Aesthetic knowing. With the past experience, help client to reduce his or her pain, stress, anxiety by providing music, dance, humor, literature, and painting. Use evidence-based practice and provide information and knowledge regarding the disease condition such as causes, sign and symptom, management, and its complication.
Next, I will discuss to you the interventions to Mr. Aniston using the 4 quadrants that are adapted from Wilber's integral theory, which includes the internal, interpersonal, behavioral, and external. Under internal, it is developing healing intention. For this, the nurse will assess and explore Mr. Aniston's personal concerns, cultural values and beliefs, and how this new diagnosis changes his daily life to provide holistic care. The nurse will also try to understand the patient's point of view by evaluating his or her own worries if having the same situation. And the next one is experiencing personal wholeness. The nurse will prepare herself holistically, her mind, body, spirit, and energy to provide care to Mr. Aniston. The next intervention is under interpersonal. In this one, it is cultivating healing relationships. After knowing Mr. Aniston's fear and anxiety, the nurse will explain more about the treatment plan and plan different techniques to alleviate Mr. Aniston's anxiety. The nurse will also provide knowledge about the disease process and will communicate clearly to Mr. Aniston, answer all his concerns, and inform him well of his care. The nurse will also explain the side effects and outcomes of chemotherapy. The nurse will show compassion and provide support to Mr. Aniston during intervention and provision of care. And for the next intervention under interpersonal is creating healing organizations. It is working collaboratively to meet Mr. Aniston's health needs. It is also to give pain medication as prescribed when required and using technology such as a stethoscope to auscultate lungs for abnormal breath sounds to ensure equal air entry and using humidifier to help loosen the secretions. The next intervention is under behavioral. It is practicing healthy lifestyle and applying collaborative medicine. Under practicing healthy lifestyle, nurses will teach patient positive behavior towards their treatment therapy and recovery, such as proper diet and exercise. It is also to teach patient breathing retaining exercises or pursed sleep breathing to reduce work during breathing. It also arrange smoking cessation classes. Imaginary and relaxation therapies work well, especially in the case of Mr. Aniston when he's worried about his health and knowledge deficit about the disease process. And the next intervention is applying collaborative medicine. Nurses will also involve Mr. Aniston's family in the plan of care and treatment as family support is important in difficult time. It is also ensuring patients' personal beliefs and preferences are being taken care. Consider alternative pain control methods such as biofeedback and relaxation methods to increase the patient's sense of control and effective airway clearance by chest physiotherapy and bronchodilator as indicated. And the last intervention is under external. It is building healing spaces and fostering ecological sustainability. So for building healing spaces, it is to provide a quiet, well-ventilated, and clean environment for the patient, and for fostering ecological sustainability, it is to encourage Mr. Aniston to spend time outside like walking or sitting in the garden for fresh air and relaxing moment. So the intervention is from the inner environment to outer environment.
Thank you, Abigail. So the client evaluation is the patient is demonstrating improved ventilation and adequate oxygenation, demonstrating patent airway, and the secretions are thin now, and clear breath sounds, and noiseless respiration. The patient denies any pain, and he seems comfortable and seems less anxious as his fear about the treatment because his concern was addressed, and have adequate knowledge about chemotherapy treatment, side effects, and recovery time. And Mr. Aniston appreciate the healthcare team for supporting at this difficult time. And Mr. Aniston is more positive towards his recovery now. And the next is our references. Thank you so much. Please feel free to ask any question and have a wonderful day.